Hello, Toro DPT class of 2024. My name is Nick Perigine, and I'm with the group that's working with the patient Kenney Wilkensen here. The purpose of this video is just give you a little bit of a background so when you see the full presentation later in the semester, you have a better idea of what's going on. So, Kenney presents to the clinic. He's a 16-year-old kid, Northern European descent, and he tells us that he has some pain on the outside of his right knee. It's been going on for a couple weeks, really nagging him. Wasn't too bad until 2 weeks ago. It was too much for him. It was really affecting his ability to work as a part-time carpet remover with his uncle, and he was having, it was really affecting his play on the weekends with his soccer team. Kenney, like most 16-year-olds, lives with his parents, but he's got two younger sisters who have visual and auditory deficits. So his parents really have their hands full with the younger sisters, so Kenney's really taking the lead on seeking out treatment here. So 2 weeks ago, Kenney goes to the doctor, he gets an x-ray, and they tell him that he has chondromalacia patella, which is just a breakdown of the cartilage on the backside of the kneecap. Doc tells him, rest ice for 2 weeks, take some anti-inflammatories, see how it goes, and if it's still bothering you, see PT. So, that chondromalacia patella, like I said, is just a breakdown of the cartilage. For some people, it doesn't cause pain. For someone like Kenney, this might be where that lateral pain is coming from. There's different grades of chondromalacia patella and patellofemoral pain, but Kenney's only 16. This hasn't been an issue for that long, so we're not too worried about the state of the cartilage as it is now, but we want to prevent it from getting worse and degenerating further. So after Kenney gives us the whole backstory, we start taking some measurements, and we know that Kenney has a leg length discrepancy of 1/2 inch. So his right leg is 1/2 inch longer. That's something we really want to pay attention to. We test his strength, and we see that the flexion and extension of his right hip and the flexion and extension of his right knee are a 4 out of 5. So he's still pretty strong, but it's just a little bit weaker than the left. We also notice that Kenney has excessive foot pronation on his right side. He's known about this for a while. He's gone to a podiatrist. He's gotten orthotics before, but he really didn't like them. He didn't wear them too often. So we know that Kenney is not going to be terribly compliant if we try and, pursue this route and get him more orthotics. He also tells us that he has the most pain when he's descending stairs. And at rest, it's really just a 2 out of 10, a little bit of a nagging pain, but it gets up to a 5 out of 10 when he's doing these types of activities. While we're going through these motions, we notice that there is a relatively poor contraction on his right quad, which might explain some of that weakness on the right side. And we also notice that his right patellofemoral joint has an excessive lateral glide. And that just means that his right kneecap is kind of pushing out a little bit as he's bending his knee, which also, that might be a contributing factor for his knee pain. And also, Kenney is 6 foot tall. He's 140 pounds. He's a slighter build. And, he's 16. He might have just undergone a growth spurt that might be putting some stress, pulling those muscles a little tighter, putting a little more stress on the joints. Not the cause of his pain, but just, another piece of the puzzle. All right, we start taking our goniometric measurements. Nothing terribly concerning until we see that knee flexion there. He has 10 less degrees on his right versus left actively. Same thing with his dorsiflexion, except this is limited both actively and passively. This is, nothing too crazy, but it's just, like I said, another piece of the puzzle. He's tight, he's weak. Things are starting to click. And on the bottom there, we see he has a positive Thomas test, and that just tells us that his rectus femoris is tight, and also his IT band is tight, which is also going to explain that lateral tracking. Kenney tells us that his goal for PT is just he wants to get back to work, he wants to get back to playing sports. 16-year-old kid, you don't really think of getting back to work as a huge thing, but he's got this situation at home with the two younger sisters. His parents have their hands full. So, that might be something that's very important to him. So that's something we really want to focus on, minimizing his pain and getting him back to doing what he needs to do as soon as possible. That's all we've really got for you for now. like I said, later in the semester, closer to Thanksgiving, you'll see a longer presentation of how we deal with Kenney here. If you guys have any questions before then, feel free to reach out to us third years. We'll be glad to explain whatever you need explained. Until then, have a good one. Good luck. Thanks for listening.